Good morning, everyone. Welcome to the CSG Stay at Work, Return to Work webinar. My name is Dina Klimpina, and I'm a policy analyst for the State Exchange on Employment and Disability here at the Council of State Governments. The Council of State Governments is the nation's only nonpartisan nonprofit organization serving all three branches of government. This morning's webinar will focus on This morning's webinar will focus on policies aimed at assisting workers in transitioning back to or staying at work following disability or injury incurred on or off the job. We'll also introduce how policymakers can use the Council of State Government's Stay at Work, Return to Work Toolkit as a resource to initiate the development of new Stay at Work, Return to Work policies. The toolkit stemmed from the work of the U.S. Department of Labor's Office of Disability and Employment Policy's State Exchange on Employment and Disability, otherwise known as SEED, as well as their National Work Matters framework. Both of these reports were provided in an email you received yesterday, and if you did not receive it, feel free to use the chat feature on the right of your webinar to send us a message, and we'll make sure that you get it shortly. Specifically, what we aim to discuss today is why stay-at-work, return-to-work issues are important at both the personal and the policy level for both employees and employers. If questions come up prior to the end of the webinar, feel free to use the question feature on the side of the screen, which looks like a small conversation bubble. And I will be reading off 2 to 3 questions for our panelists at the end of the webinar. We will also have captioning available. There's a link that was included in your email yesterday, as well as a link included in the chat box. You will currently be viewing all of our panelists at the same time. So to change that feature, you can click on the View tab at the top left portion of the screen. The drop-down menu says Everyone, and you can change that to View Who's Talking or View the Presenter, or hide webcams if that is easier for you. The webinar is going to be more conversational in style. However, to introduce the topic, we will be having Dr. Chris McLaren from the Department of Labor's Office of Disability and Employment Policy.
Thanks, Dina. So I'd like to just provide a quick overview of the Stay at Work, Return to Work policy area. Each year, millions of Americans experience an injury or illness that puts them at risk of leaving the workforce. A large number of these occur on the job, but an even larger number occur off the job. When someone is unable to work or leaves the labor force because they become sick or have an accident, it can be detrimental for them, for their families, their employers, as well as state, local, and federal governments. Some estimates put the total cost of injuries and illnesses among the working population in hundreds of billions of dollars per year in lost productivity and wages. This is not counting some costs such as lower quality of life that are much more difficult to quantify. Workers lose income and may become socially isolated, and the longer someone is out of work, the harder it is to return. Employers lose a productive worker and face replacement and retraining costs, as well as potentially higher workers' compensation premiums. Governments lose tax revenues from lower employment and spending. State governments may feel pressure on state disability programs, and the federal government faces large numbers of SSDI and SSI applicants and benefits payments, straining the SSDI trust fund. However, when people are able to stay in their job or return to work after an injury or illness, all stakeholders benefit: the workers, employers, governments, and society as a whole. There are policies out there designed to help workers that experience an injury or illness on or off the job to stay at work or return to work. For example, at the employer level, state workers' compensation policies, public and private disability insurance in the workforce development system. But the policies are sparse, and it is difficult to navigate these systems, and many workers fall through the cracks. Now, while there are some people that will not be able to get back to work, there are large numbers of people that can stay in their job or return to work if they receive timely and appropriate services and supports. So Stay at Work, Return to Work policies focus on providing these services, supports, and incentives to ultimately improve the employment outcomes of people with work disabilities. These policies encompass a range of options, many of which we will hear about in today's webinar. They may include things like incentivizing employer accommodations, providing subsidies to employers to rehire individuals. And there's a growing body of evidence that early intervention strategies that coordinate healthcare and employment services may significantly improve outcomes for workers. As many of you may be aware, the Office of Disability Employment Policy, or ODEP, is currently leading an effort in partnership with the Employment and Training Administration and the Social Security Administration to test the impact of some of these early intervention strategies in what is called RETAIN, or the Retaining Employment and Talent After Injury Illness Network. So 8 states were awarded grants to develop stay-at-work, return-to-work programs to coordinate these services based on the successful Centers of Occupational Health and Education, or COHE, model in Washington State's workers' compensation system. So we're looking forward as these states develop and implement their programs to improve stay-at-work, return-to-work outcomes, but also to learn and to share best practices along the way. There are many stakeholders involved in the stay-at-work, return-to-work process, but states play a critical role. Recognizing the benefits of these policies and the important role that states play, the State Exchange on Employment and Disability, SEED, collaborated with the Council of State Governments to develop the Stay-at-Work, Return-to-Work State Policy Toolkit that Dina mentioned in her opening remarks. This toolkit was developed with input from state leaders, subject matter experts, and government representatives. It is designed to help states identify policy options, best practices, and implementation strategies that may improve the labor force participation of individuals who become ill or injured while in the workforce. It also highlights a number of states that have implemented highly effective stay-at-work, return-to-work policies. And it also provides talking points for state policymakers. This toolkit will be a living document as well, which we will update periodically as we learn more through RETAIN and from other sources. So we look forward to hearing more about specific actions states may consider from the toolkit, which Bobby Silverstein will discuss in more detail later in this webinar, as well as the experiences and advice from our other great panel members. So before I turn it over back to Dina, I would also like to briefly mention the ODEP-funded Campaign for Disability Employment, which is addressing stay-at-work, return-to-work strategies in its latest television public service announcement. So through the voice of several individuals, Working Works explores the many reasons people work, including after injury or illness. It has 4 cast members, one of them being Cal Ripken Jr., the baseball player, who's also known as Iron Man because he played, there was over 2,600 consecutive games in the major leagues. And 3 other people who worked with their employers and healthcare providers to make a plan to successfully remain employed following their injury or illness. So this is currently airing on TV stations nationwide, and you can also access and download it on the website whatcanyoudocampaign.org. I'm sure that'll be provided somewhere. The website also has a number of tools, and we really would recommend that you check it out to learn what resources are on there and to help us spread the word about this important message. So with that, turn it back to Dina, and thank you for having me.
Thank you so much, Dr. McLaren. So we will be sure to send you a link to that video as well following this webinar. Now we will have 4 wonderful presenters who have in-depth knowledge and experience in implementing and planning stay-at-work to return-to-work policies. So let's have our 4 guests briefly introduce themselves, starting with Senator Becky Massey.
Yes, hi. Thanks, Dina. I'm Senator Becky Massey. I serve in the Tennessee Senate representing Knox County and have been a member. I was elected first in 2011. And my background, actually, for 24 years, I was a disability provider here in Knoxville serving adults with intellectual disabilities. And it's been an honor to serve on these task force.
It's been a pleasure having you. Thank you. Let's go next with Beth Kuhn from the Kentucky Cabinet for Health and Family Services.
Good morning, everyone. My name is Beth Kuhn, and I, as Dina indicated, am at the Cabinet for Health and Family Services in Kentucky, and I was previously the workforce commissioner. So I came at these issues from two perspectives, the workforce perspective and the human service and health perspective. And so I'm really happy to bring that to the table and join the discussion today. Thank you.
Welcome, and we look forward to hearing about your work in Kentucky. Up next, we have Delegate Shuri Sample Hughes, who I believe is joining by phone. Or perhaps we'll give her a few minutes. Bobby Silverstein, please introduce yourself.
Sure. My name is Bobby Silverstein. I'm a member of the State Exchange Unemployment and Disability team. I had the privilege of being one of the lead authors of the toolkit, and in a former life I was staff director and chief counsel and a subcommittee on disability policy when we wrote the Americans with Disabilities Act, reauthorizations of the Rehab Act, and the Individuals with Disabilities Education Act.
Wonderful. So we're very lucky to have you all today. So while we wait for Delegate Sample Hughes to get on, I think that we can go ahead and get started. So first of all, I think it's important to know why this topic is important. So why should we care? So let's have Senator Becky Massey tell us why should legislators engage on this issue?
Great.
I think experiencing a little bit of technical difficulties. It's quite all right. While we wait for that to be fixed, Beth, I believe you're still with us. Would you like to give us a little bit of why this topic is important for the workforce at large?
Yes, so I'll talk about the perspective that we bring here in Kentucky and why we see this as an important issue in a couple respects. And I think Chris alluded to it in his remarks. It's an important topic for business because businesses lose people every day and they need talent. So it's an important issue for the workforce because it's important for business to have the talent they need and because it's a cost driver. So that's one reason that we see it really from a workforce perspective. From the human perspective, it's important for all of us. What we know about work is it feeds our family, it keeps us bringing our game to the table every day. So there's the dignity, there's the opportunity that work brings, there's the health that work brings. And so for, I think, us in Kentucky, and for me personally, as I've had the chance to engage on this issue, and really in the CSG framework that we're here engaging on today, I see this as a purple issue. And what I mean by that is, if you're arguing this from a red state perspective, you come at it from a business angle. It's about economic drivers. You can come at this from a blue state, humanistic. It's good for people. It is really about caring for those in need. And really, you put it all together, it's an issue that touches everyone in a positive way if we do it right. And so I think the why is really clear. It's about all of those cases we can make for it. So I see Senator Massey is back, and maybe she can add to the comments that I just made.
Right. Sorry, I got disconnected there for a little bit, and hopefully I don't have a wired connection, so hopefully you won't lose me again. Can you ask the question that you want me to answer? I heard the tail end of your comments, Beth, so I think I was supposed to be addressing why it's important as legislators to participate, to engage on. Okay. Well, Chris went over a lot of the statistics on the cost it is to lose a worker, whether it's temporary or permanent, more importantly, sometimes permanent. So it really is important, as Beth said, especially in really all states, whether you're a red state or not, it's important to the economy, to the state, and the businesses. but more importantly, it's important to the quality of life of the individuals affected. Yeah, it's estimated that state government would save about $83,000 in net benefits for each worker who is retained rather than replaced through the onset of long-term disability. And one thing that I think people get confused at, they think of a disability and they think it's permanent, but really a lot of disabilities are very static, and people can return to work or stay at work while they're dealing with their disability. And, that should be the number one goal when anybody receives an on-the-job or off-the-job injury, is to get them back to work as quickly as possible. I said that research shows that the timely and appropriate state policies and programs that facilitate the stay-at-work, return-to-work strategies early in the process, with a focus on maintaining the employer-employee relationship, are some of the most effective ways to support positive employment outcomes for individuals, with resulting in increased tax revenue and reduced dependence upon benefit programs. State officials are the primary influencers when it comes to adopting policies that promote and facilitate the transition back to work for individuals who have become disengaged from the workforce due to the illness, injury, or disability.
And Dina, if I could just pick up on one thing Senator Massey said, I think it's this particular issue, this stay at work, return to work, it's not just what Senator Massey said about it's not necessarily a long-term thing, having a disability, it might be short-term. It also means we sometimes segment that people with disabilities as a separate population. This topic is about all of us. And I don't know if Delegate Sample Hughes has joined or if there are others that have had this experience, but this is about workplace or injuries off the job. You may go out of this webinar and not have a disability, and in 2 hours find yourself in a situation where this very topic could impact you or your family. And so I think that makes it both a huge need and a huge opportunity, whether you sit where I sit in the executive branch with the chance to implement policy and change practice, whether you sit where Senator Massey sits passing laws that can change the way we do it. It's really a universal opportunity.
Absolutely. It's really about the workforce as a whole. And I do believe that we have Delegate Sample Hughes on the phone as well. Well, while we are waiting to correct our technical difficulties, I was wondering if both of you could maybe talk a little bit about your experiences, as well as some of the challenges and opportunities that you do see in implementing stay at work and return to work policies in your states. So, Senator Massey, you were one of the original members of the Work Matters Task Force, as well as a participant with the Stay at Work, Return to Work Toolkit. So, how did you as a legislator begin to engage on this issue?
Well, I mean, I actually worked on the employing people with disabilities toolkit that CSG and NCSL put together first, and that gave kind of a good background. And so then moved to this work group, and it really was fascinating because while I've been in the disability field for a long time, I guess I really hadn't considered the hard costs that are associated with losing the workers to the economy and to the state. I mean, I knew in general, but when you really start looking at the big dollars, that's when things really start adding up. They always say when you add a bunch of zeros, pretty soon you're looking at some real money. But I think it's important, there's several things to do to start with, and like I say, this has been educational for me, but, the first thing I think that we had talked about doing was to take an assessment of where you are in your state and really to see, where are the opportunities, where are the challenges, where are the gaps. And then after you do that, you can look at the low-hanging fruit. An example is if you can have your state agency to develop policy guides that describe best practices for designing, implementing, and evaluating the return to work, stay at work programs. Another thing is to educate and train the stakeholders on the cost and the benefits and the return on the investment of these type of programs. You can start with pilot programs, and then some ideas could actually be implemented through policy changes without having to be accomplished legislatively. So there's a number of areas that states and individuals could look at, kind of attacking the problem and educating folks on what you could do to work together to get it done.
Absolutely. I think those are really great points. And thank you for talking about your experience with that. Beth, I believe that you were also a member of the Kentucky Work Matters Task Force. I was wondering if you could share a little bit about your experience with that and how you determined that this was a priority for the state of Kentucky, and how and why did Kentucky choose to address these issues?
Yep. So I would make a couple comments about really Kentucky's journey on these issues and sort of how that might apply to other states considering taking more action here. The first thing I would say is it's always about leadership. And so I'm not in Tennessee, even though they're a very nice neighbor and I visit them frequently, but I'm confident that Senator Massey's role in driving some of these issues as a legislative leader has been meaningful there. In Kentucky, we have been fortunate in that Governor Bevin has been really taken a personal interest and leadership role on the issues of employment, and really our journey began when Kentucky was the first state to take the national Work Matters effort and create a state Work Matters task force. And so when I was workforce commissioner, I had the opportunity to sit on that task force. We looked at 5 populations around employment, including people with disabilities, veterans, foster youth, people reentering from corrections, and those experiencing substance and opioid use disorder. Again, to my earlier comments, everyone, right? And out of that work sprang sort of our next step, which is something we're currently operating now, an Employment First Council. And so we're trying to stay at a high level involving multiple stakeholders, looking at all the policies and practices across the state that could enable more employment of more populations. Why do we care? Because Kentucky has very low workforce participation. So I go back to what I said before. This is enabling better workforce participation and more opportunity for everyone. And out of those sort of beachheads, those big picture efforts, came an application that we made for the Retain Grant. And so Chris mentioned that earlier. We in Kentucky are one of the 8 states that received a Retain Grant. And what I would say about that, without going too deep for the few minutes that I have here, is that we're really taking in all of this work a comprehensive approach that says we need multiple agencies and stakeholders at the table. I believe we may be the only state, I'm not sure this is true, but our Voc Rehab, our vocational rehabilitation agency, is the lead partner there. But we have our Cabinet for Health and Family Services, our vocational rehabilitation agency with Kids at Workforce, workers' comp, employers. We've got many stakeholders coming together. Why? Because of the impact that this has in so many places. So we're trying to take a comprehensive and coordinated approach, looking specifically at the healthcare sector, which is where a lot of workers get workplace injuries caring for others, and how do we get them to stay at work and return to work? We feel like we'll get double benefit because they're staying, taking care of those who have health issues, and also staying in the workforce. So that's a little bit of the Kentucky story. I see that Delegate Sample Hughes has joined us. Yay! So I think I'll turn the floor over to her so we can hear some of her comments as well.
Hey, can everyone hear me now? Oh my goodness, technical difficulties. But it certainly is a pleasure to be here with everyone this morning and to be able to speak on a very, very important topic. I think as being a legislator here in the state of Maryland, I know we have heightened the awareness of the return to work policies through just educating people, which I think is the first step in all this process, is making them aware of first the programs that exist and then find out exactly where the gaps and challenges are. And I hear a lot of that while I'm on the Health and Government Operations Committee in the House, and also serve on insurance subcommittee and long-term care as well. So not only hearing it from constituency, what the concerns are, but also in the committee work that I do. So I think it was said either by Senator Massey or by Beth Kuhn, you had indicated that you don't know whether or not today or tomorrow you could be impacted personally. And so for me, that actually is the case. Unfortunately, in 2017, my oldest son, he was on a fire truck because he's serving our community as a volunteer firefighter. And he was on the fire truck with two of his other colleagues, and they were putting out these devices on the roadway to indicate where fire hydrants are. And so as a mother, my concern has always been, as a volunteer firefighter, would it be a smoke inhalation issue or some fire that he would be involved in? But unfortunately, on that particular Sunday afternoon, he had fallen off of the fire truck. And when he fallen off of the fire truck, he was ran over by that same fire truck he was working from. And within minutes, or seconds, I should say, his life changed, our life changed. And I had already started, working in this space of this being a very important issue through my work with women in government, but not knowing that one day I would have to understand it a little bit more and realize that my own son, who at that time was 18, was very passionate about going into the fire service full time, that his life would be changed and he would have multiple injuries. So just fast forwarding a little bit, he has had, as I said, multiple surgeries and now is still in rehab, making sure he has physical therapy on 3 days a week now. But his life has changed in the sense where he was preparing academically and physically for fire service long term. But now we are, as a family, looking at and having to make adjustments for his work life and what that looks like long term. And that includes, us as a family making decisions, but then also his personal wherewithal as far as making decisions, and along with his physician. So if I could, just wanted to share with you that your mindset changes as well. I shifted from a lawmaker to a parent, like, oh, this really has impacted me, where I need to make sure that there's tools in place to ensure that when persons are injured on the job or off the job or whatever the case may be, that we need to make sure we're adaptive to their needs and making sure that the policies are in place if they are injured and then can and want to return to work, but it may have to be modified. And so my work now is not only certainly professionally, because I've been know that this is important prior to, but when it has this personal impact, and now needing to figure out what other roles and what other a career choice my son will now have to undertake because of the challenge that occurred with his accident. Something real. We need to continue to work on it and think of it holistically and help people along the way.
Thank you for sharing your personal story. And it's something that I think is really, really important to know, that it affects both people personally as well as professionally, and really affects the workforce comprehensively as a whole. So it's really a very big issue. And now, Delegate Sample Hughes, I was wondering if you could talk a little bit about the new policies that you've filed this session.
Sure. Absolutely. So in doing the advocacy and putting that together with a lot of education from persons like Bobby Silverstein, Senator Maskey, and just over the past few years, I knew it was time to move us forward in the state of Maryland. And so what I am proposing to do, and I have filed legislation, and that is to deal with the Workers' Compensation Commission requiring an annual report on the return to work. We have a report, if you will, but it's not as comprehensive as it can be. The goal is to ensure that the report that comes from the Workers' Compensation Commission that deals with returning to work is reflective of what programs are in place, identify what the gaps are, analyze the true policies so we can look at persons who are needing to return to work and wanting to make sure that they are productive in their efforts. And so for me as a legislator, I was just thinking that we need to at least make sure we have a comprehensive report and make sure we are meeting the needs of the people, and where we're not meeting those needs, we have to at least have a document and the data to back up the message, if you will. And so the other piece that this legislation deals with is with early intervention policies, working along with employers to ensure that they may have some best practices in place. And where they don't, then we figure out how to get them there. We have one particular program in the state of Maryland that allows people to get skilled training in a particular field, whatever their interest is, but adapting to their needs. And then at the end of the program, they're then able to get a certificate to show forth and to put it on their resume, but go and use this certificate when they go on job interviews and show forth that they do have a skill set. They have a skill set that can be used across the board, those types of transferable skills. And it has been useful in the sense where I was working with a young woman. She's blind, and she now is gainfully employed, I must say, with the Board of Education. And before, she was very concerned about, will she be able to take care of herself beyond her parents helping her? She's now gainfully employed. She has insurance. And so, it's just the things that we can do creatively, but it also strengthens some of the policies that we currently have is very key. So this report, as I just mentioned, once again, is that it's an effort to make sure the governor, the legislature, and the business community are aware of what policies can be put in place and where we need to identify what those gaps are. So that's the first step. I chose not to put in the second piece of legislation that requires funding because in doing the research and meeting with the Appropriations Committee, they first asked me, do you have a report? Do you understand where the gaps and the needs are? And so I figured, okay, this is our first step here in the state of Maryland, make it a more comprehensive effort, and then go in for the money next year. Thank you.
Thank you so much for walking us through that. So I really appreciated hearing all of your experiences. So today we really discussed everything from bill initiation on report generation to really full state task force development in identifying the policy needs and priorities for many states to identifying broad policy options that can be generalized across states. So we've discussed how states like Tennessee, Kentucky, and Maryland have taken these steps. But we also want to talk a little bit about what you'll find in the Stay at Work, Return to Work toolkit that you've received, which has all of the options that we've talked about today, as well as a few more as for policymakers to use. So to present that, we will turn this over to Mr. Bobby Silverstein.
Thank you. I was fortunate to be part of the SEED team and, as I said, one of the lead authors of the toolkit. We took our responsibilities very seriously to reflect what the leadership team wanted. These were state policymakers, as you can imagine, who said, it's a toolkit. Make it simple, use bullets, give us a number of different approaches, give us policy actions, best practices, implement strategies, give us the definitions, give us links, give us talking points, the kind of things that policymakers need to do their job. So we took that very seriously. And so this toolkit is designed to reflect that. The first section deals with costs and benefits and articulates in bullet form a number of the real issues that are faced by employers, by employees, and the state government, and describes, again, through listening to various states and undertaking research, what are some of the costs and benefits from different perspectives. Now, from the state's perspective, there were costs. If somebody leaves the workforce, there are going to be benefits that are going to be paid. State workers' comp, long-term, short-term disability. There may be increased Medicaid costs. From the employer's perspective, they may be paying higher premiums because of experience rating on workers' comp. They may have the significant cost for the retraining of individuals. For the individual employee, the issues of social isolation, reduced quality of life. We also identified a number of the benefits, again, to state government, to employers, and to employees. When we were meeting in terms of the leadership group, it became clear that people wanted to say, you've got to recognize that every state is different. And don't have a one-size-fits-all toolkit. Recognizing the heterogeneity of the population of people with disabilities that we're dealing with. The fact that disability is not static, it is often episodic, and the population of employers varies. So having a policy context was very critical. We needed to recognize the various stakeholders and players in this system, from the healthcare practitioners to the workplace managers to the claims administrators. The state policymakers said, before we get into the specifics, we need to articulate a set of principles to guide decision making so that when we have to decide what is or not included in legislation, we have a set of decision rules. And so we articulated a number of key principles to guide efforts to adopt state work return to work policies. Now, there happens to be one state, the state of Washington, who has developed a very comprehensive approach, both with respect to training healthcare providers through what is called the Centers of Occupational Health and Education that they have throughout the state to help the healthcare providers know best practices in terms of occupational health. The state of Washington also has a number of programs that provide resources to employers, that provide financial incentives to have people stay at work, and then a preferred worker program for those who leave a particular employer, but other employers around the country get an incentive for hiring people with disabilities who were in the workers' compensation system. People always want to know at this point in time, is there a return on investment, particularly in days of limited resources? So we included comprehensive results of evaluations, cost evaluations of the state of Washington program, where they found that decreased medical costs and a 21% reduction in the likelihood of being out of work and on a disability 1 year after injury, 21% reduction. They also found overall long-term disability for the state fund down 20%. 20% reduction in long-term disability because of the combination of the various programs. We also identified public sector programs, that is, the state government programs that have been developed around the country. And in each case, when we include a reference to a state, in this case Delaware, Maryland, and West Virginia, there are hyperlinks to the actual program. There we identified state vocational rehabilitation programs that are designed to help employers retain individuals who have become injured either on or off the job. It's a new provision in the Rehabilitation Act that allows VR agencies to serve this population. Then we identified state policies in the private sector, ranging from wage subsidies for returning injured or ill employees to subsidies and incentives for accommodations. Some states use insurance premium discounts to incentivize. Other states have grant programs for transitional work. Some states actually have employee incentives to try to get the injured worker to come back to work. For example, Maine recently enacted, I think in 2017, workers' comp benefits cannot be reduced if the employee is actively participating in a prescribed rehab program. Another topic that we identified was wellness and injury prevention programs. And a number of states have developed workplace safety programs and qualified loss management programs dealing with absence and disability management. In addition to developing or describing state policies that have been adopted around the country, we also looked at a number of states who have developed guides, stay at work, return to work guides. And we have links to all those guides. But we also described in summary form the best practices and implementation strategies that we learned from reviewing these documents. Again, always trying to provide this in bullet form. People wanted to make sure that some of the terminology that is used in disability policy or workers' compensation is not well known. So we have a comprehensive glossary, and each term that's defined, there is a hyperlink to the source of that. We have developed talking points that folks can use when they want to discuss this issue with their colleagues. That's the first appendix. There's an appendix on accessible transportation, which was identified as a key issue. And then some people don't like words, they like graphics. So we have graphical depictions of the stay at work, return to work policy and practice, both for those who have experienced occupational illnesses or injuries, as well as non-occupational return to work. And then there's a comprehensive bibliography. Now, one thing that I'd like to share with you is that the SEED project is here to help and provide policy assistance to you all, so that if there's something in this toolkit and they say, I would like to adopt or research the possibility of introducing legislation in my state, we are here to help you research your state, draft a bill for you, legislative specifications, discuss it with you given your the politics in your state, modify it based on the input, and then help you to introduce legislation. Thank you.
Thank you, Bobby. That was such a great overview. So I wanted to go ahead and maybe talk a little bit, ask a few questions and give the audience an opportunity to ask some questions, because I know we've had a generally broad discussion. So one thing I want to go ahead and start with is to all of our wonderful panelists. So what are some of the policies that you've seen that have been the most effective within your state? What do you think has been the best change that you have made?
I mean, this is Senator Massey. We're still a work in progress. We became an employment first state several years ago with our former Governor Haslam that presented that, and we've been doing building blocks on it. As Bobby said, the SEED will help draft legislation, and I'm actually been working with Bobby and the SEED staff this year to introduce making Tennessee a model disability employer. So while we've been putting things in place to encourage employment of people with disabilities or people that have workplace injury, on-the-job injury, or off-the-job injury, we haven't been the model employer. So we're working in conjunction with them to get that passed this year.
I think I would just echo what Senator Massey said. I think we're not at the point where we can really brag on our policies so much as brag on our sort of evolution and comprehensive approach and our pilot. So we're trying to learn as we go here, and I'm hoping that, as these webinars come back, and we'll be back bragging on some more of our policies that we develop that say, we've got this thing figured out. But just like Senator Massey said, we just went through the Employment First executive order. We're looking at some of the same sort of best practices, and I think the role of SEED and ODEP and CSG and getting us all sort of in line around some of these best practices has really been helpful too. But we really just want to get some experimentation and practicing on this going on, because really that's where the success is going to come from here.
Great. And like you said previously, it really is, it's about engaging, and it's about leadership, and it's about going out on a limb and at least attempting to initiate these policies. So what advice would you give for a policymaker that would like to get something going, that would like to draft something? Where do you suggest that they start?
Well, first I would suggest they get the toolkit. Both this one and Work Matters too, because they kind of go hand in hand, and delve in that. I think they're really good resources for policymakers, and you find, and like I say, go for the low hanging fruit first. But utilize these resources, utilize the resources of SEED and ODEP, because they're there to help, and their wealth of knowledge is just unimaginable. They just are amazing.
And, I have the phrase low-hanging fruit written down too. So obviously Senator Massey and I compared notes. The other thing I would say, so I'll just take a nerdy moment here, but there's something way back from my early days of studying workforce productivity called the Hawthorne effect. For those of you nerds in the audience, that what that basically is when they went out and studied worker productivity, what they came to learn is if they studied the workers, they got more productive. And so I'm not at all suggesting that it's an easy issue to tackle. There's a lot of complexity here. You need a lot of people at the table. There's a lot of policy directions you can go in. I am suggesting, though, just like Senator Massey said, we have a great toolkit that was really well thought out and developed, and pick an issue in your state that your governor or your business community or your leader who cares about this issue is driven to solve. And really this whole issue of, stay at work, return to work, it fits in a lot of directions. So there really isn't a bad way to come at this, and anything you do to start is going to have a positive impact. So I feel like that's my best advice as a starting point.
Oh, yes. So this is, I wanted to, I've been listening. This has been a very, really informative panel discussion today, and I think we've learned a lot. And it's great to hear your experiences and advice. And I did want to echo a few of the comments made today so far, just to point out. Well, I guess two quick points. The first is that I think that this toolkit and all these best practices are extremely valuable, but the interesting or the unique aspect is that every state is different. And so I think there's a lot of these general themes that come up in best practices. And I think that looking at the toolkit and some of the other, of course, going to SEED and others to identify what actually will work in your state is an important thing to remember, because the employment landscape is different, and even the insurance systems are different. And I would like to say one last thing about SEED, and also as they relate to retain. I know that ODEP is improving the employment outcomes of people with disabilities is obviously ODEP's primary mission, and improving the stay at work, return to work outcomes is a growing interest, given the importance of these policies and the great benefit they can have on people. 8 states, including Kentucky, received a retain grant and is working to develop these policies. But we also see SEED as being an opportunity to help other states that maybe didn't get a retain award but are interested in these topics and interested in doing something. So I just want to encourage everyone who's watching as well. Because we definitely want to provide as much help as we can.
Thank you so much. I really, really appreciate that. And we've really enjoyed working with the team at ODEP and SEED. It's been a great partnership. So we do have another really great audience question, though. So I believe it comes from the state of Tennessee.
Yay!
Yeah. So while it is really important to talk to state leaders and talk to people who are engaged at the state level and who are initiating policy change, there's a lot of people who are perhaps in the public or the private sectors within each state. So the question at its core is, so how do policymakers and other state stakeholders, whether in private or in the other public sectors, how do we make sure that we're engaging all the stakeholders that we can?
Well, I think it's important. We've all got really fantastic organizations in each of our states that work with people either that have permanent disabilities or that have short-term disabilities. And, the Veterans Affairs organizations are working with our veterans that are that have a need here. So I think it is just good to know where your resources are, know how to reach out to those folks. They know how to reach out to the policymakers at the big level. But most legislators are out and about in their community at all times. I don't go to the grocery store that somebody doesn't talk to me about something that's important to them. So it's just that accessibility and the communication of what's going on and what the needs are and how we can work together to make an impact and make a difference. There's no magic wand. You're not going to solve it all in one fell swoop, but if we keep on working toward it and if we make a difference for one person, we've done a good job. So that's kind of the way I've always approached it.
And I would just love to build on that, certainly from the agency's perspective and over here in the executive branch of government. It's something I'm really passionate about, certainly on whatever cabinet or agency you're in, there are mandatory advisory groups that many of us have. And then for issues like this that are touching so many individuals as well as businesses, we have to get really creative and resourceful about where we go for input and partnership. And so just our Retain grant, we have found some of the best sources of ideas and input have come from organizations in the healthcare sector that we never had a relationship before, that were sort of 1 and 2 sort of referrals away from relationships we had when we started. And so you have to start with the relationships you have as your advisory and your collaborative partners and your contractors, and then you have to build out from there for all the stakeholders, because this is the kind of issue that if you do that, you will find solutions you will never, trust me, I know, you will never find sitting in a state office building. And so I think that's where the real opportunity and creativity lie, and that's a great question. I think one we have to be obligated to answer.
Great. Thank you all. Thank you for that question as well. Again, if you have any other questions, we can do maybe about 1 or 2 more. I think the other question that we've gotten today is, so what have been the biggest challenges from both the executive as well as the legislative side to initiating some kind of policy change? Are there any just roadblocks that you've had to overcome or have not been able to overcome? And so specifically for your 2 states, what is the most challenging part?
Well, I mean, I'll go ahead and go first. I think the largest challenge is...
Okay, Dana, do you want me to talk? Is Senator Massey off again?
Yes, I think while we're waiting for her to get back online, we'll go ahead and why don't you answer to your biggest challenges?
Okay, we're super cross-functional and collaborative, but man, people speak different languages on these issues. I think Bobby alluded to it in the toolkit and the glossary, but when you get sort of some businesses, the workers' comp people, the VR people, and others around the table, that has been a challenge just in getting everyone on the same page, both acronym trading and just having the same perspective on sometimes what it is we're trying to solve. So I think just getting everyone on the same page technically, and really just trying to remind us what our common purpose is. So really, I think that's been a big challenge for us that we've had to solve, just getting, because we've come at it in such a cross-functional way. I think that's our strength, but I think it adds some complexity and some sort of multilingualism that we've had to take on in order to really work effectively together.
Wonderful. Thank you. Thanks for that. Yes, I think interdepartmental collaboration can definitely get difficult, especially if you're speaking different languages. So how about you, Senator Massey? What have you found to be your biggest challenges?
Okay, I guess we may have talked at the same time. So I think our biggest challenge is really is helping educate all policymakers on that, because they really don't understand the return on the investment. It's when you're looking at funding things in state government, you're not looking at between good and bad. You're looking at good and good, and you've got to wisely invest these hard-earned state dollars. I think another thing is it's a challenge to communicate the benefits to all the stakeholders. And make sure everybody's all on the same page. As I think, a lot of times, obviously, people work in silos, so we need to be working more cohesively together, and I think that's been mentioned before. And then, like I say, the dollars to get the program started. We know that there's ultimately it's going to save the state money, but that's front end dollars. If you don't have a grant, if you're not a part of the retained grant or something, you've got to work through that and be able to show that the funds will come back.
Absolutely. So I think we're actually running out of time. So thank you all for your wonderful, wonderful responses. I think that you've given everybody on this webinar a lot to think about. So I'm just going to give everybody a quick opportunity if you have anything to close with or anything.
This is Bobby. I just wanted to reiterate the SEED team is here to help you walk through the toolkit if you have any questions. Also to actually research your state policy, develop draft-led specifications for stay at work, return to work legislation, help you think through the local state politics, and then redraft it based on your needs. And so we're here to help provide that policy assistance.
Thank you, Bobby. Senator Massey, to close?
I don't have anything else. Just get the toolkits, learn about it, and obviously use our resources through the toolkits and through SEED and ODEP. And good luck.
Thank you. Beth?
I would just echo some of the earlier comments and say anything is better than nothing. You can start small on this issue, engage a few of your business leaders and get them on board with the ROI. I think Senator Massey's point on that was excellent. If you get a few of your business leaders on board with the ROI and the opportunity to engage on this issue, that would be a really good starting point. And from there, you might find a path for your state that is really effective.
Well, thank you. Thank you for those words of wisdom, and thank you for sharing your state experiences. We all really appreciate it. So on behalf of the State Exchange on Employment and Disability, thank you all for participating. Thank you for coming here to learn, and feel free to contact me or any of us here if you have any questions or if you are interested in implementing any new state work return to work policies in your state. We're here to help, and we're here to be a resource. So thank you all, and have a wonderful, wonderful long weekend.
Thank you.
Thank you.
Thank you.